Did you know that brain damage doesn't always happen suddenly? In many cases, your body whispers early warnings long before things get serious. The problem is, most people ignore them. Today, we're going to uncover 8 early symptoms of brain damage you should never ignore. These signs may appear subtle, but they can reveal what's happening inside the most important organ in your body, your brain. Stay with me until the end, because the first symptom we'll cover is often mistaken for something minor, yet it can be one of the clearest red flags of trouble. Symptom number 8. Memory loss that feels unusual. We all forget things from time to time, misplacing your keys, blanking on a name, or forgetting why you walked into a room. That's normal, but when memory problems become frequent and interfere with daily life, it's different. If you can't remember recent conversations, directions, or simple tasks that you used to manage easily, your brain could be struggling. Early brain damage affects the hippocampus, the center of memory. Ignoring this may mean overlooking one of the earliest warning signs of decline. Symptom number 7. Sudden personality or mood changes. Have you or someone you love suddenly become more irritable, depressed, or anxious for no clear reason? Changes in personality or mood swings can happen when the frontal lobe, the part of your brain that controls emotions and behavior, is affected. Many people dismiss this as stress, but consistent, unexplained shifts in mood may actually be a neurological warning. Your brain is telling you that something isn't right. Symptom number 6. Trouble with coordination and balance. Do you find yourself stumbling more often, feeling dizzy, or having difficulty with tasks that require coordination? The cerebellum at the back of the brain controls movement and balance. Damage in this area can make simple tasks, like walking straight, buttoning a shirt, or climbing stairs, feel harder. If balance issues appear suddenly or worsen over time, it may not just be clumsiness. It could be a sign of brain impairment. Symptom number 5. Persistent headaches. Headaches are common, but when they become severe, frequent, or unusual in pattern, pay attention. Persistent headaches that don't respond to usual remedies can indicate increased pressure or inflammation in the brain. Some people experience sharp stabbing pain. Others feel constant pressure. While not every headache means brain damage, ignoring recurrent or worsening pain could mean missing a vital warning. Symptom number 4. Difficulty speaking or understanding words. Have you noticed slurred speech, trouble finding the right words, or difficulty understanding simple instructions? Language centers in the brain, particularly the left hemisphere, are sensitive to damage. Even mild impairment here can change how you communicate. Sometimes people laugh it off as just being tired, but persistent speech difficulties are never something to ignore. They can be early signs of stroke or other brain conditions. Symptom number 3. Vision problems that appear suddenly. Your eyes may be fine, but your brain is what processes vision. If you notice sudden blurriness, double vision, or partial vision loss, it may signal damage to the occipital lobe or to the pathways that connect the eye to the brain. Many people rush to the optometrist, but if glasses don't solve the issue, it could be neurological. Visual disturbances are one of the body's clearest cries for help. Symptom number 2. Numbness, or weakness on one side of the body. If you feel weakness, tingling, or numbness in an arm, leg, or one side of the face, it may point to brain damage. This can happen when certain brain areas controlling movement and sensation are impaired. Sometimes the weakness comes and goes, making it easy to dismiss. But even brief episodes can be serious. Doctors warn that sudden one-sided numbness should be treated as an emergency. It could mean a stroke in progress. Symptom number 1. Seizures. Seizures are one of the most alarming signs of brain trouble. They can appear as full convulsions, or as subtle moments where you blank out or lose awareness for a few seconds. Seizures occur when abnormal electrical activity spreads across the brain. They can result from head trauma, tumors, infections, or other forms of brain damage. If you or someone you know experiences seizures for the first time, it's critical to seek medical help immediately. Before we continue, let me remind you, we've included extra resources and doctor-approved information about protecting your brain health in the description below this video. So after you finish watching, go check it out. It could make a real difference. The brain is the command center of the body. It controls our thoughts, movements, emotions, and memories. But when it's under attack, it rarely shouts, it whispers. Memory loss, mood changes, coordination problems, persistent headaches, speech issues, vision disturbances, numbness, and seizures. These are not random events. They are your brain's early alarm system. Don't wait until it's too late. If you or a loved one experience any of these symptoms, seek professional help as soon as possible. Your future, your independence, and your quality of life all depend on protecting this remarkable organ. Remember, prevention and awareness are always more powerful than treatment after the fact. If you found this helpful, hit like, share this video with your friends and family, and don't forget to subscribe for more vital health insights. Your brain is your greatest asset. Listen to it, protect it, and take action today.